Sometimes it's out with the old and in with the new, but I mean, we don't normally think about it with teeth, but we are today, right?
Oh yeah, Pamela Wetzel and Dale Pertner are here to share all about the alternative traditional dentures, dental implant surgery. All right, so for Frankel Dentistry, Pamela, you've been here before.
Yes, I have.
You've talked to us before about the importance of keeping your teeth clean.
Right.
And this is a prime example of something that you can do if there's an issue that doesn't necessarily happen.
Correct.
Get us up to speed.
Well, you know, the story is someone who hesitated to go in the dentist. They were afraid. They had a number of reasons they didn't go, and things got out of control. And so they're at a point where they can't save their teeth. And it used to be that we would do traditional dentures. And I know I had a grandfather, and when he talked, he had this loving little click all the time. So what we can do now is we have titanium roots, they're implants, and we can secure a denture in your mouth like natural teeth.
That's amazing.
It is amazing. You can talk, you can chew.
I think about my grandma too, where she would have so loved to have this because she was always so self-conscious about it. And you know, they came out. Blowing out candles.
And you see, I'll tell you what, one of the big things is this, so. Well, what I want to, and one thing about Dr. Frankel, when you go there, there's no pressure whatsoever that you've got to have something done.
Right.
In fact, I'm the kind of guy, the reason why, I had to get dentures was because years and years of neglect and you're always scared about going to the dentist.
Well, I was going to say, it's also generational too. My mother is very afraid of going to the dentist because it used to hurt. And now when you practice, it's going to be gentle.
So different.
It is. And that's one thing that I want to say, because I'm not paid to come here. I'm here because of the goodness of my heart, because I want to pay back. One of the big things about Frankel Dentistry is this. I was worried if you would have heard the language that I had in my mouth when I got out of that truck, what am I getting myself into? But as soon as you open the door, I don't care if it's in Maumee or you're in Toledo, the offices, I'm going to tell you what, you feel at home, and right away, the first person you come to, the lady says, how may I help you? And it's friendship. And I'll tell you what, everyone I've run across, and that's no kidding. That's the truth. I don't lie about that, not about the thing is this, so you feel so comfortable.
Okay.
And they always ask you.
I'm going to stop you right now.
Go ahead.
What did you have done? Okay.
I had to lower. You go ahead and explain it, because I like to hear you talk.
Well, no, let's tell it.
No, it's like,
I had the bottom dentures done, and I plan on living to be 100. I'm 69. I plan on living to be 100. I originally didn't think about it till the more they explained it to me. When I put that lower denture, because if you ever notice people that have dentures when you get older, what happens is there's a little play there. Guess what? And all of a sudden I can't eat steak.
Right.
You know, and it gets so bad. I don't care what these people say. Where's the camera at? But I'll tell you what, it gets so doggone bad, Eric and Rebecca. That hey, you can't even chew water. You got to do something.
Chew water? Did you say chew water?
That is correct. That's how bad. Hey, your teeth can
There
get.
have been some water issues here in Northwest Ohio.
No. Here's the thing though. But I wanted when I put them in, and they're locked in.
So they feel comfortable. They feel like your own teeth. We're going to show some
Exactly.
picture here. Pamela, what is the video that we're seeing right
Now,
there?
these are the screw-retained implant dentures, and you can see these are permanently placed. You do come for cleanings. You'll come in for cleanings, and they'll remove them and clean them for you, and you take care of them, and it's life-changing. One of the things that people don't realize, when you take teeth out, the jawbone melts away.
Okay.
So a denture, what's especially, and the reason he's talking about the lower denture, with the lower denture specifically, that could be a real problem because that jawbone gets so thin. There have been cases where the jawbone actually broke.
Oh my God, you need that structure.
You need the implants. It stimulates the bone to stay stable.
Okay. So the process, the first thing you did, you went in there, you had a wonderful experience even from the get-go, but I don't know if your title still is concierge, but you've always done that. It gives them a comfortable feeling.
Right.
Yes.
Well, we make them comfortable, and the first thing we do is evaluate their entire mouth, take x-rays, take photographs in different positions, making like all those different positions. Then also we take a CT scan. This is the part that is so amazing. This is all done with AI. So they study the entire skull, and they strategically place the titanium roots where there's the most bone, where the pressure is going to be equalized in the jaw, and where it's the ideal position to have your denture.
How do we come in? Tell us where you are, how do we start the process?
You can go online, jonfrankeldentistry.com, and schedule an appointment. If you'd like to use your phone, you can call at 419-474-9611 or 419-893-0221.
Thank you for being here. Dale, we're going to get you to come out of your shell next time you're on the show.
I'd like to. I'd like to.
We got to wrap, though. They're telling us to get out of here. Thank you so much once again. Coming up, we're revisiting our favorite moments of the week in the 9 Rewind.